On preparing for medical school. I myself am an OBGYN who focuses on taking care of high-risk pregnant patients in the Bay Area. I do work at the University of California, San Francisco, but the views and things that I'll be sharing today are reflective of my own experience. And I'm not on the admissions committee for the School of Medicine, so I can't get you in through any backdoor, but really hope that this conversation can serve to make you guys feel empowered in pursuing medicine if it turns out that that's the right fit for you. And I'm so lucky to be joined today by Rahwa Hailemichael, who is a wonderful second-year medical student who I actually knew from her pre-med days. And we are so excited to have the opportunity to talk with one another and with you all about kind of different things that we think are really important to keep in mind as you consider going into medicine and how best to prepare yourself. So we're going to, start off our conversation responding to some of the things that we navigated as we pursued our own journeys into medicine, and also in response to some of the questions that you guys have put forward through the Instagram. But again, I just want to encourage folks to drop questions as we go into the chat. And so I'll just kick us off with the first question, which will go to the fabulous Rahwa to talk about kind of what first drew you to medicine.
Okay. Hi, everyone. So as Martha said, my name is Rahwa Hailemichael. So I guess I'll start off by speaking a little bit about myself. I was born in Ethiopia, grew up there for a bit before moving to Eritrea, and then immigrated to the United States when I was about 9 years old. And my family and I moved to Southern California, and then I moved up to the Bay Area to attend undergrad at UC Berkeley, and kind of lived out in Oakland before kind of moving here for medical school. I'm here in Illinois now. So I think for me, like what drew me to medicine was just my experiences of just growing up in an underserved community and kind of seeing the need for medical professionals, and just really seeing like the lack of medical professionals that were there. And by serving as my parents' translator and advocate from a young age, I kind of got to see the financial as well as language barriers that my parents face and other people in my community. So that kind of inspired me to kind of consider medicine. And I think like through my classes and through my personal experiences, I was kind of always interested in like service-oriented work. And and then I kind of landed on, taking the classes and developing an interest in public health and things like that, and became pre-med.
Wow, no, I thank you for sharing that. I think having, I'm the eldest of five kids. My parents immigrated here from Eritrea, and so I definitely can resonate with being the person who had to explain what my mom was experiencing or what my siblings were experiencing in doctor's visits. And I think it's part of the reason why I'm so passionate about taking opportunities like this to encourage us to be, in spaces where we can help take care of one another. I think for myself, when I think back to also the early days, what drew me to medicine is I remember specifically having a respiratory illness and going into the hospital, like not feeling like I could breathe and feeling, so grateful for the doctor who saved my life. In my mind, I was probably just having a little bit of a respiratory bug, but was just inspired by that person. And from that point on, I told everyone whoever asked me like that's what I was going to be doing. So.
So for you, like, when did you start preparing for medical school and kind of thinking like in that track?
Yeah. So I think, as I mentioned, I was really young when I felt like I was interested in medicine, and I told a lot of people that I had this desire to do this. And so I think I sort of sought out opportunities quite early on in high school. And I think we might even have some high schoolers in the audience. That's really exciting that you have a sense that you want to do that type of work. I had started by volunteering at one of the pediatric hospitals that was in Houston, which is where I grew up. And I think that there are probably experiences that are available to many of you guys in the area, to sort of reach out to a local hospital or clinic, or sometimes even facilities like nursing homes have the ability to give you exposure to what it means to actually be in front of patients, taking care of them, and what healthcare providers do. I was also really lucky that at the high school that I was at, there was a program specifically for students that were interested in health-oriented careers. So did a lot of volunteering with that. And then when I went into college, I was very much sort of looking for the communities that would allow me to experience, to do more work and get more experience in healthcare. And so I say that to say I was somebody who knew early. And I think if you do know that you're interested in medicine early, like definitely I think sharing that with people so that they can think of you when they encounter doctors or they see an opportunity is really helpful. Don't be shy. I think sometimes we can be like, oh, I do want to be a doctor, but am I smart enough, or am I, are my grades good enough? But if you're early, you have time to prepare yourself. But I also know many people that I went to medical school with who did not know that they wanted to be doctors that early. In fact, I went to school with people who were teachers before they went into medicine. One was a lawyer. And so people come to things when it's right for them. And so definitely don't feel like you're too late if you're not somebody like me who knew out of the gate. In some ways, I feel like I could have done some more exploring of other things in advance, but I'm grateful for where I am now.
Yeah, I think for me, I was more of the shy pre-med that you described. I had an interest in medicine, as I mentioned, from those experiences, and kind of wanted to go into like a service-oriented profession, but was kind of hesitant about doing medicine because, as we all know, the time frame and in terms of like the amount of training that I would have to do, and just like kind of doubting my skills and my ability to go into it, I guess, also. But I think around sophomore year of college is kind of like when I really committed to, the idea that I was going to go to medical school, and kind of started pursuing more opportunities in that realm. But even before then, because I had that in the back of my mind, I did take like AP courses, like science-based AP courses in high school, and did some of the volunteering work that Martha spoke about like in hospitals, or like, you can help in like the cafeteria or like senior homes and things like that, just to kind of get that exposure.
Yeah, definitely. And I think, I mentioned that there are people kind of decide whether to do medical school at different times. And there are, these opportunities that are what are considered extracurricular that you can find on your own time to kind of get more exposure to healthcare and really solidify if it's the right thing for you. But there are also kind of, core requirements that are necessary in order to be able to apply. And since you, Rahwa, are a little bit closer to it, I'm wondering if you could go over kind of what things you found that were necessary as you were applying into medical school to have done.
Yeah, so the basic essential things that are needed is you'll need an undergraduate degree. And that's just like a BA. You don't have to have a science background. I know I had friends that were like English majors or like theater majors, anything like that, so long as you have the pre-medical requirements that they have for medical school, which include courses like science, chemistry, physics, things like that. More information on that can be found in the AAMC website, and there will be a blog post following this talk within like a week time frame where you can find that resource. You'll also need to take the MCAT, which is the entrance exam that we have here in the States, before going into med school. And yeah, that's essentially all that I could think about that are like, the basic requirements. But then of course there are like extracurricular experiences and like work experiences and things like that that definitely help your application, so that you can have things to talk about in terms of like what led you to medicine, why you're interested in it, and things like that.
Yeah, definitely. And I just want to emphasize that you don't have to major in a science. Your parents will probably tell you something different. Mine told me that, but I did sociology in undergrad. I went to Harvard for college and did a minor in Spanish and also in health policy. And so I think you don't have to sort of stick to like biology or chemistry or physics in order to go to medical school. And in fact, you don't even have to take all of your science requirements during college. So there are people who decide that they want to go to medical school later, or maybe during college want to focus on sort of other coursework. And there are ways to take the classes that are required for medical school separately, like through a community college or through, if you have many classes that you haven't done, or you want the extra support in order to prepare yourself for medical school, there's something called post-bac programs or post-bachelor programs, I think is essentially what they stand for, that you'd be doing with other colleagues who are also interested in applying into medicine that will allow you to kind of meet those requirements. But you do have to take Orgo, and you do have to take those at some point. And I think, it's not that I think medical schools in general are becoming more holistic in how they're evaluating candidates, but you do have to do well on things like the MCAT and in your GPA in order to be competitive there. And if grades or things are or exams are something that's difficult to you, definitely encourage you to reach out to colleagues that may have gone through the process more recently than you, or recently, like with the MCAT, to find out about like test prep courses and things like that you could take advantage of, or sometimes even get their old resources so that you can feel as prepared as possible. One of the things that you started to touch on though, Rahwa, and I think goes to that like being a holistic medical school candidate, is that it's not just about the coursework and sort of checking off those boxes, but there are other things that you put into your application that medical schools pay attention to. And I'm just curious, kind of, what are some of the extracurriculars that you became involved with or have heard that your classmates have been doing?
Yeah, I think for me with extracurriculars, I kind of try to, there's like some that like are obviously related to healthcare that you can do that may look good on your application, like things like research and things like that, which are important. But I think with anything extracurricular, sorry, that you pursue, I think it's important to kind of just like navigate it in terms of like what your personal interests are. I think that's what helped me the most in terms of like having more things to talk about during my interview season. Like, for example, I was a health educator with the International Rescue Committee there in Oakland. And that was like such a great experience for me because I was passionate about working with refugees and I was passionate about working with my community. So I got to help a lot with newly admitted, newly resettled Eritreans and Ethiopians that had just come to the area and kind of helping them navigate like applying for Medicare and like the social service offices and things like that, and like serving as a translator. I also worked at a teen clinic, and that was also another thing that I was passionate about because it was in the neighborhood that I grew up in where there's like high rates of STI and underage pregnancies and things like that. So it was like really amazing for me because I also majored in public health. So it was nice to go back and do that kind of public health work in the San Fernando Valley. So I think like, I think the things that people tell you to hit on are like research, volunteer, and leadership board on like your school, like student orgs. And I think all of those are important, but again, like kind of just keeping that lens of like making sure that it's things that you are passionate about and things like that. So it could be worth your time and also give you that added benefit of like, having a plethora of things to talk about.
Yeah, I will just echo, I did a lot of different things every summer when I was in college that I ended up putting on my application. And so I think you do want to explore things that you're interested and passionate about. And sometimes summer experiences or getting involved with different organizations can be a good way to figure out what you like or don't like. I remember working in a lab my freshman year of summer and was like, I definitely don't want to do this, but you could still put it on my resume. I think as somebody who has been involved in like in interviews and reviewing applications before, the one thing I'll emphasize is it's really important to have clinical exposure kind of somewhere on your CV as if possible. I think medicine is a really challenging field. There are lots of things about it that are not exactly like Grey's Anatomy or House or those, and it's helpful for those who are interviewing to know that you kind of have seen behind the, behind the curtain, so to speak, and know kind of what you're getting yourself into. So trying to find opportunities to do clinical work is important. I think the other thing that Rahwa, you touched on was like leadership. Like, I think that people love to see that perhaps that you've been in an organization and started out as a member and then, joined as a secretary or vice president, president, like showing commitment and sort of, climbing is really valuable. I think that there are times where I've gotten applications and people have like 20 or 30 different activities that they're doing, and it almost seems like they're doing it for their CV rather than that it's something that they're really dedicated to. So I'd much rather see that somebody's doing only a handful of things, but has really taken ownership over pushing an initiative forward or investing in a community than seeing that they did a lot of different things, but more as a spectator or less involved, if that makes sense. I see a great question that kind of piggybacks off of that in the chat about sort of like if you had chosen to get a master's degree or had work in related fields, how can you highlight this in your medical school application? So I'm wondering, Rahwa, how did you highlight some of the work that you were doing in your application?
Yeah. So for me, I worked as a nurse's aide at a children's hospital. So I talked a lot about like what my interactions with the patients look like, what my interactions with the families look like, and how that, like how those interactions kind of helped inspire me further to pursue medicine. Essentially, how being there to care for someone during their vulnerable state. I worked in a post-surgical unit. So, patients were unable to walk and things like that, essentially. And I was kind of there to help guide them in those first couple of days. So just speaking about like why I valued those interactions and how that kind of helped informed why I want to go into medicine, essentially, because like I kind of wanted to, continue to work in those kind of environments. And then I also spoke about like, how those settings allowed me to see the other professions within healthcare as well. Like I got to work with the nursing staff. I got to see a few of the residents, not necessarily work directly with them, but kind of just kind of being able to speak about like, working in that clinical team and, speaking, that allowed me to speak more so about like how I also hope to do that in the future as well. Because I think some of the questions that came up for me during my interviews was like, why medicine as opposed to another career, like other healthcare profession. So having that experience allowed me to say why particularly medicine it was the field that I wanted to go to, as opposed to like PA school or like nursing and things like that.
Yeah, no, that's great. I think just to like pull out some of the things that you mentioned, I think one place where you can put these experiences and definitely degrees, if you got your master's in public health or social work, that sort of thing is on your application. So there are places where you indicate different degrees that you've gotten, where you've taken certain coursework. So definitely want to put it there. Different experiences also have their sort of place on ERAS, I think is what you guys are still using, or I don't know the names of
ERAS is for residency, right?
A residency. Okay.
Yeah. In a literal sense, there is an activity section and then a personal statement. So you can mention those things on there.
Definitely. And so I encourage you guys now also to like start keeping track of all the things that you're doing, especially things that you have a leadership role in, even if they're just like a one-time like festival or outreach health fair, making sure that you're documenting kind of when you did that work and what your specific roles are, just so that it's a little bit easier to put it into the application when the time comes. And then, like Rahwa was mentioning, you can also incorporate things into your personal statement, or some schools actually have like secondary applications where they ask certain questions. And then in your interview is another time to really really sort of, call on these experiences and share them. I think one of the things that was really critical for me going through this process as I was sort of thinking about medical school was mentorship. And Rahwa and I were just talking about how we actually both did the same summer program back when we were in undergrad that really helped us. So I'll give a shout out for Health Career Connections, and we'll drop the link in the chat. But I think the other thing, is that while experience, we definitely encourage you to seek out talks like this one where you can hear from people and their experiences and ask questions. It's really powerful to have sort of a mentor who really knows you and gets to help you learn different skills and kind of can help give you advice on your journey. And so I'm curious, Rahwa, like if you had to think back about a big mentor that was in your life, who would you, or how has mentorship played into your walk and journey in medicine?
Yeah, so as as a first generation low income student and as an immigrant as well, I really was not aware of the medical school journey. I kind of, was following the tail of this interest that I had. And I think I'll admit that like till this day, it's kind of like a learning process for me. But I'm grateful that I'm so grateful to have mentors that, kind of fill in those gaps for me till this day. I think one of my biggest mentors was in undergrad, Dr. Matsuyu. I joined the biology scholars program during my sophomore year when I was, kind of sure that I wanted to pursue a pre-medical route. And he was amazing in terms of like letting me know summer programs that I could apply to, letting me know scholarships and things like that to make it financially feasible for me to do some of these programs. So he was a huge advocate for me. But I've also been fortunate to have other sorts of mentors that have been cheerleaders in my life, and that goes for my family and friends and professors that have, that are like willing to kind of read over my essays and my secondaries and things like that. And also upperclassmen. I think that's also an understated area of like seeking out mentors. I think it's super important to have upperclassmen as mentors because they kind of, demystify like the courses and things like that you should be doing in like the immediate future. And it kind of helps to just kind of get their idea of like what resources they use for certain classes, what resources they used when applying to medical school, like how they kind of manage their secondaries, the approach they did while studying for MCATs and things like that. So that's, mentorship is important. I would say the best place to start would likely be with a faculty member that you connect with, also like an academic counselor, but also like that upperclassman who's, in a similar major to you that you connect with, and then just kind of starting from there.
Yeah, I agree. I think even at my point on faculty, I think mentorship is huge. And I think that you can have different mentors for different, aspects of your journey. So sometimes those near peer mentors, like the person who's a year or two ahead of you or a big sib and sort of a student group that you're in can be really helpful in terms of negotiating sort of the nuts and bolts of like, this is where you get your transcript from. This is like how soon you need to ask for letters. This is the actual name of the platform because I'm 10 years, 15 years out from applying. And so they just know a little bit, they're more contemporary with that kind of stuff. But then having people who maybe are faculty in a sort of in the type of medicine that you see yourself doing. So in women's health, for example, I was very excited when Rahwa reached out to me, kind of interested in doing research together. And, or if you're interested in, doing global health work or going back to, East Africa to do work, finding people who can really sort of encourage you and talk to you about what programs you can start to get experience through, or what institutions would be best positioned to support you moving forward is really key. And we didn't put this on our initial sort of list of questions, but I did see it come through in the chat. And I think it's helpful to maybe plug it in here as this question of like, how do you think about which schools to apply to? And I'll share a little bit about kind of what my thought process was, and Rahwa, I'd love to hear from you. But I think that I think MCAT should have like a list of the different sort of medical schools that are available. And I think for me, one of the big things that was important to me was kind of like location. Like I wanted to be in an area that where either like I had family or community, or at least was a city where I would be excited to live in. So that was one of the things that I was thinking about, was like, different, like applied to a lot of programs in Texas where my family is close by. I was, as I mentioned before, on the East Coast for college, so I was very comfortable kind of looking at schools in that region, and added on some other places, beyond that. And then I think I did a lot of talking to mentors about sort of my interests, which at the time were in pediatrics. I kind of shifted upstream doing pregnancy related care, but I thought at that time I was going to be a pediatrician for sure. So it's okay to change your mind, but but ended up talking to people about kind of places where I would get good exposure and be able to kind of continue to further my interest in global health. And also, was really interested in working with communities that were like made vulnerable by structural issues. And so I think that those were things that were really top of mind when I was thinking about programs, as like places where I would, kind of areas where I kind of knew people or had community or resources that would be around to support me. And then also programs that were known for being strong and preparing people to engage in global health was another thing that was important to me. I don't know how you navigated that process.
Yeah, kind of similarly, although now I'm here in Illinois, so I kind of, so the AAMC has an MSAR resource, which I'm not sure if you guys are familiar with it, but there's, I think it's called FAP. It's, I want to say it's called Fee Assistance Program for the MCAT. And if you qualify for that, you also get the MSAR free, which kind of tells you, like it's like a database for the last 20 or 10 years of like average MCAT scores, average GPAs of applicants to those med schools. And you can kind of like filter that based on like your data points to kind of see like what are your chances with that particular institution. I mean, you can still, shoot your shot to say and kind of apply. It doesn't mean you have to follow it, but I think that kind of helped guide my idea of like where to apply to. Another thing that I did was I looked at the school's websites a lot. Diversity was something that was important to me. So I looked at what the student body kind of looked like, what type of things they had in place in terms of DEI work, in terms of resources for underrepresented students and things like that. And then also looking at what type of support that they offered students, whether that be through like counseling and things like that, but also like step one resources and things like that, just so that I can ensure that I was like going to be in a supported environment that was going to help me, thrive to my best capacity.
Yeah, I think the other thing I'll share that came to mind was I did go to certain conferences. Like I remember going to SNMA, the Student National Medical Association conference. So that's a student group mainly for individuals that are in medical school, and it's the largest group of African American or Black identifying medical students. And as an undergrad, there's a comparable program called MAPS, I think is what it's the acronym. But that was a really amazing way to like meet, Black students from all over the country who were representing their institution, and they would have like tables where you could go and learn more about their programs. A lot of times it was catered towards, the medical students and trying to get them there for residency. But if you're there on the earlier side, you can also take advantage of the opportunity to kind of learn more about what it was like for those at the table to go to school there or to be training there. So taking advantage of those kind of opportunities can be really nice. I think also taking advantage of your network, like if you know people who are in medicine and asking them kind of like what they think about different programs, if I think people are always happy to kind of hear about your interests and make recommendations. Great.
Sorry, I just wanted to add, that just reminded me. And when you mentioned the conference that you attended, I know that the UCs for those in California have like similar fairs, and I attended those the year that I applied. I think it's helpful to do that at the year that you apply. I mean, it's nice to go and get exposure, as Martha was saying beforehand as well. But I think once you, if you go the year that you're applying, it's nice to kind of be at the forefront of the administration that may be looking at your application. So I'd suggest those. I can't quite remember the name, but I know UC Davis and UC Riverside and Irvine have those. And they also host like mock interviews and things like that. I think it's like through Me Mentor, I want to say.
Yeah, and I'll just give a shout out to Niat Haptamariam, who is actually on the National Maps Committee, and she just dropped a link in the chat. For those who are interested in like learning more, please take advantage. There's so many amazing resources even in this community, so that is wonderful. I will say also now in the setting of COVID, a lot of schools like the UCs, like Rahwa were mentioning, are doing a lot of Zoom sort of webinars and things so people can learn more about their programs. So if there are places that you're interested in learning more about or potentially meeting some of the students that are there, I think that checking out their website is really key, and getting a sense of like what it's like to be there from the perspective of a student is really important. One of the questions that came through Instagram actually that we got in advance of today that I thought was a really good one was kind of like what part of the medical school application process or interview process was the most challenging, and kind of how did we overcome it? And so I'm happy to take that question first, Rahwa, or do you have something in mind that?
No, I'd love to hear your answer.
Yeah, I think there were a few things that came to mind. It is a tough process. I think logistically, one of the things that took quite a bit of time was kind of like filling out the application and kind of having all the information available about sort of when I did different programs, how many hours per week I thought it took, kind of who was a mentor, that sort of thing, and listing the responsibilities. So I think I always encourage people, and I still do this now, to like update your resume or CV kind of in real time, like as you're doing activities, as you get an award, or as you complete a program, kind of making sure that you get that information and kind of think about your responsibilities at that time, just to make it a little bit easier. And so you don't forget anything that like was really impactful to you when you're going through the application is key. I think on a personal level, the thing that I found really hard was the personal statement. I think, it's like your time to really share with the reader kind of why medicine. And I think I had gotten a lot of advice about, it can't just be that you are good at science and you want to help people, because there are lots of people who like science or and want to give back. And so just making it really capture like who I am and what I really wanted to seek out in medical school was, I think, really it required me to turn inward. But I think one of the things that I found really helpful was kind of quickly getting a draft down and getting it out to people to get feedback quickly. I think sometimes with things that are personal, we want to hold them to our chest, and we are very sensitive to it. But I think as long as you're asking people who you really trust and who do, are in the medical field or have experience with writing to get feedback, I think the sooner you get feedback and the more you can edit it, the hopefully the more proud you'll feel when you finally get that personal statement out there. But I think that with the application, that was tough for me. I was also going to say, like, the other part of it was very expensive to fly around, but I think that's changing in terms of how interviews are happening now.
Yeah, I think for me, it was similar. The personal statement was just challenging, as you said, just kind of putting into words all of the reasons that you see yourself going to this profession, all of the reasons that you've done X, Y, and Z to get to this point, and kind of like really creating a captivating story of that, that captured like who you were in essence, what you see yourself doing, and what you imagine you'll contribute into the field. It was kind of difficult, just like having that first draft. But when it came to, the secondaries and things like that, I found that I was a bit more organized because someone had given me the advice to kind of just have an Excel spreadsheet of putting in the dates when I got the secondaries, and then making sure that I kind of sent those out in a 2-week time frame. That was challenging, but I felt like I was more organized in that, I had that spreadsheet, and I was more able to answer those questions just because I had that personal statement done. So my advice would be to just kind of start with a draft. It doesn't have to be anything perfect. Just put words onto a paper and just keep on editing that. And as Martha was mentioning, like allow others who you feel comfortable with to read it and kind of get it to that stage that you're happy with, so that you can have that ready ahead of time. And yeah, I think another thing that was challenging for me was the interview aspect. Personally, I just, I'm getting good at this. This is like my second talk that I've given with Martha, so she's helping me through it. But I don't necessarily, it's challenging for me to do these kind of talks. I found it difficult to do interviews, but I would say, maybe set up a few mock interviews with someone that you're comfortable with, so that you can, just demystify the whole process and just be more comfortable talking about yourself and painting yourself in the best picture.
Yeah, first of all, isn't she great, guys? This is why I keep roping her into things like this, because I think she is wonderful, and so are all of you. And I think when you get to the point where you're doing interviews, you have passed a huge hurdle, right? To get to that point. Like, people want to meet you, is what I always tell folks when, I'm doing interviews. I'm like, I'm grateful that you are here learning more about our program or our institution. And it's really an opportunity to kind of bring your application to life. And I think it is important, I've been actually working with a group of medical students that are interested in doing OBGYN residency and kind of helping them get ready for interviews. It's, you don't want to be too rehearsed. You don't want to sort of, seem robotic with your answers, but to have kind of talked through kind of why medicine, why that institution, why, what are your passions, I think is really helpful. I also think you can probably find online kind of like general interview questions to anticipate. There are some like bread and butter ones of like, what are your strengths? What are your weaknesses? And like, caring too much, guys, is not a weakness, like having real things to sort of share with folks that really sort of capture your story are helpful. And I think you can almost anticipate kind of certain buckets of questions. And I think knowing that in advance can let you think like, oh, what was kind of a challenging situation that I like overcame? And you can use that anecdote kind of to answer a couple of different questions, but kind of, preparing yourself doing mock interviews, I think is really helpful. And I think now we've been moving more towards Zoom interviews, which I think, is not always the easiest, but there are ways that you can sort of help yourself, with like, you can have notes on the side, like those sorts of things, like take advantage of that, the circumstances, as things allow. One thing I kind of alluded to, it was very expensive in my day. We had to like, fly out to every place. And if you didn't know somebody, get hotel rooms. But I think now things are moving more online, but still applying to medical school is expensive. And then going to medical school is expensive. So I don't know if Rahwa, you want to share a little bit about some resources that people should think about or look into when trying to navigate that process.
Yeah. So my year, it was on Zoom, which was super convenient. So that was a plus. But as she mentioned, it did have like its awkward aspects in the beginning, just because you're on camera, it's kind of like hard to gauge, but the programs are kind of getting good about like, having breakout rooms and things like that for you to even like meet the other applicants and things like that. So you'll be fine and you'll save money. So that's great. In terms of the MCAT, I would suggest looking into the fee assistance program that I had mentioned earlier. I can't quite remember if it's reduced or if it's completely free, but I know that with that application, they also include the MSAR, which was the other database that I was mentioning that kind of gives you that information of like what applicants have looked like to those programs. And in addition, I think it pays for, I want to say like 20 secondary applications, which is super helpful because I can't quite remember how much secondary applications cost because I had that resource, but I think they go upwards of like 80 to 100. So definitely look into that. And when the deadline for that is, you can find that also on the AAMC website. In terms of resources, once you're in medical school, so truthfully, it's just you're a full-time student. Even if you do work, I have some friends that work in the library, but that's kind of like work study. It's nothing to really support your means of living. It's kind of like pocket money to say. So I would looking into government assistance programs. That was unfortunately not something that my institution was fully aware of, but something that I have been fortunate to come across through my own research and also through the research of other students, looking into qualifying for assistance in terms of like paying for your utilities, assistance for paying for your rent. You can qualify for Medicare and as well as SNAP. And those have, personally been really helpful in terms of like making medical school feasible for me as an low income student.
Yeah, I think, looking into, there are grants that you can get through the government. There are also different schools will have financial aid, offices and things that you can talk with in advance. Like you should have a sense kind of when you get the offer letter about what they can, the packages that they can offer to you. I think also, exploring scholarship opportunities through some of the national societies. Like I think, the National Medical Association and other entities have scholarships that are available. So don't count yourself out, and definitely take advantage of applying to even like, what can seem like smaller scholarships can make a huge difference of like $5,000, $10,000 here or there, can have a huge impact. Great. I think that, one of the other things that, might be coming up for you guys is sort of, how to stay sane through this process, like how to and how to also like let other people around you know how to support you and as you sort of pursue medicine. And I think it's really important to sort of name that this process is very stressful. Like going into medicine is stressful. Medical school is quite an intense process, as is residency and, life on the other side. So really figuring out for you kind of what is really important to your wellness and what helps you feel resilient, I think is key. Whether it's exercise, hopefully it includes exercise and community and doing things that you really care passionate about. I think, we've talked a lot about how, there are certain extracurriculars that give you more experience in clinical care, and that's important. But I will say, I always love seeing applications and reading about, students who have done other things, like are passionate about dance or are passionate about their culture, and sort of find ways to share that, or on social media, and sort of, have a brand in that way. And so I think don't only sort of focus on being in medicine, make sure that you're doing things that are important to you holistically. I don't know, Rahwa, if you have things that you've found helpful as like support, that have supported you in your journey so far.
Yeah, I'm like nodding my head. I completely agree. This, humbly speaking, this process is very consuming. You will have very limited time. So it's just important to kind of maintain a lifestyle that you are still like, happy with, and that is still fulfilling to you. Like me personally, I will make it to the gym at least 3 times a week is like my thing. And like Martha was mentioning, community, I've been really fortunate to find a group of friends that have made this process a lot more comfortable for me. So just kind of spending time with them and studying with them has made this process a lot easier. And trying to do little fun things whenever you can as well. I know I said that you don't have much time, but you kind of learn how to make time, so maintaining those hobbies, because it is important for your overall health.
Yeah, definitely. I think I appreciate how active people have been on the chat. I am almost a little distracted because I keep seeing these good questions come through. One that came up was like advice on taking the MCAT. And I think I'm really grateful for Niyat for mentioning that SNMA has scholarships for MCAT courses for those who are members, and so definitely take advantage of that resource. I'm just curious if you used anything that you thought was really helpful in terms of helping you prep, whether it was like podcasts or other resources.
Yeah, I did the self-guided Princeton review MCAT. I also had heard that the MCAT is now shorter because of COVID. I'm not sure if they made it full length again, but that's something else to look into. But they do have those prep courses. To be honest, they are a bit expensive. But I do think that for me personally, they were worth my money, because I didn't want to go into the classroom type of instructions that they have. I kind of wanted like a self-guided sit down and kind of put my head down for 2 months and then be ready to take it at the end of that. So I would look into that. I really did appreciate the Princeton review one.
Yeah. And I think some of it is also figuring out like what kind of learner you are. Like some people like to be self-directed. I'm similar to Rahwa, where I like just want to get through the content on my own time. I don't, other people want to do it in groups, and you can probably find other pre-meds who will study, be happy to study together. I think one big thing I would emphasize is like taking practice tests. I think I remember specifically, I had like a near peer mentor. He was like 2 years ahead of me, and I was like dragging my feet on taking a practice test. And he was like, you need to do it. Like, you have to go home today and do it, or I won't talk to you. And I did it, and I like failed, and it like motivated me to study so much. And so I think just because I think you can study content, and without kind of knowing how they're going to ask the questions, you'll be studying less effectively. So I think I strongly encourage people to try to get their hands on as many practice questions and practice exams, and like as much as you can, try to mimic what it's like to take it for what sounds like the full length is back, but like sit down and sort of, challenge yourself to do it. Cause I think some of it is endurance and also just getting familiar with how they ask questions. And that's true for not just the MCAT, but for many tests that you'll take, like step 1, there's like step 1 through 3, you'll have board exams. I'm studying for my oral MFM exams. It never stops. So now's a good time to figure out what your test taking or test prep strategy is.
Yeah, completely agree on the question directed studying. That is something that I've implemented into my medical school studying as well, because like Martha was mentioning, half the battle is kind of, you can study all the content you want, but if you don't know in what way it's going to be framed, it kind of makes it challenging in the moment. And by having those questions, answering those types of questions ahead of time, it kind of eases the worry. It absolutely does suck when you get them wrong, but it's a learning process, so it's okay.
Great. Yeah. And I will say nowadays there's so much content out there, and you want to be cautious. Like, don't just pick any YouTube channel to start learning, science from. But yeah, I think that if you're a podcast person and you like to listen to things when you're exercising, that was a big thing for me when I was in medical school, was like listening to podcasts when, going for runs and stuff. So take advantage of them, especially, and try to, focus on the areas that are your weaknesses, which I think is sometimes harder to do. But if you really hate physics and you don't feel great at it, it can be easier. You're more motivated to study biology, but like really sort of pay attention to like where you're scoring lower, and pay more attention to learning that content. I think that one sort of simple question that came up was, does working as a medical scribe count as clinical experience? Yes, I would count that as clinical experience. I think things that wouldn't count as clinical experience, but is in a clinical setting, is like if you were, say, doing registration in an emergency department, or you were like, working, and I did this, so there's no knock against it, but like if you're working in a playroom in a children's hospital, like, and that was your primary sort of activity, that's less clinical. But if you are actually sort of, working with doctors or with patients to take down information and help like sort of synthesize a note, that's really critical clinical experience. And so I would put it as such, or I would expect to, that's where I would expect to see it. Or I guess if you're getting paid, it might go under work experience, but I would, in my mind, as a reviewer, consider it clinically oriented. There was another question about any advice on letters of interest, and when to write them or when to send them when waiting for an interview invite. I did not send any letters of interest. I don't know if you did, Rahwa.
Yeah, I had sent one when I was on a wait list for an institution. It was my idea that's kind of how that was like the best time to kind of send those kind of letters. So yeah, I think when you're waiting for an interview, I don't know, because I'm kind of thinking back to the advice that I heard. I got mixed reviews in terms of like how often institutions want to hear from applicants. Like it can be perceived as a good thing or a bad thing. If it's been a couple of months, I guess maybe send it. Yeah.
Yeah, I mean, this would be me kind of sort of speculate, like sort of, making a suggestion. I think I agree with Robert. If you're on a waiting list, it can be helpful to kind of reach back out to an institution and say, like, thank you so much. I'm really hoping to get off, and share updates. Like if there are things that you've done kind of since your application that just want to make them aware of, that you think might make you more competitive, you can do that. And I think as we're sort of, after we've gone through the process of, initially screening applications and stuff, we do have interview slots open up, and hearing from somebody about their interest, I think, would be helpful. I think before the initial sort of invite letters go out, to Rahwa's point, like we're kind of inundated with applications. I'm thinking more for residency and fellowship. I again don't do the medical school applications, but it's fine to just wait until they give you an indication of like where you are. Like if you're already going to get one, then you have saved some time and you won't need to reach out. And if you are on the waiting list, then having that letter of interest, I think, would be more prudent at that point, if that's helpful. Great. I think another question that came up was, are there any requirements to take public health related courses in medical school or training? And like, what are some disparities that we've come across that have been surprising? And I would say, I think all medical schools now have incorporated some training around healthcare disparities and, bias in medicine, and how to care for diverse communities. But I think that there's probably variation to kind of how integrated that is into the curriculum and the ways in which that's being executed. I think it's definitely, to Rahwa's point, when she was sort of looking at medical schools, you can sometimes read about it on their website. It can definitely be a helpful thing to ask about on the trail. Like when you do interviews, you not only get questions asked of you, but you get the opportunity to also ask questions in turn. And so you can definitely ask questions around like how how are institutions kind of, teaching around topics of disparities. I think I don't know that there was anything that was really as surprising to me, because I did sociology in undergrad and I was very disheartened kind of knowing that there was going to be all these disparities going into medicine. But I will say, like, I think the thing that is still very frustrating to me to this day is like just insurance and lack of insurance, and kind of how that ends up dictating a lot of how I'm able to serve my patients. And that I think continues to be very frustrating thing, just around, that access point.
So after 2020, most institutions kind of adopted an anti-racist curriculum and things like that in an effort to incorporate more of those public health topics that address disparities, racial bias, and things like that in medicine. Like Martha was saying, it's not necessarily that surprising to me, just as someone that has those interests naturally. I was kind of aware of those topics, and I was also a public health major. I think in terms of the institutions, they are making an effort, but personally, I think there's still a lot of work to be done in terms of like how those courses are incorporated into our curriculum. And really just kind of incorporating those topics in everything that we are taught, because those topics kind of seep into, it's not just, they don't exist in just like a bubble, like we'll have a course on like gun violence and things like that separately, but those kind of topics and how the racial disparities around those topics kind of seep into the kind of care that someone can get, or like, the kind of physical activity that someone feels safe attaining and things like that. So I'm actually working with our institution here in terms of like developing those topics further, because it is kind of like a new wave thing that institutions are picking up with the changing climate.
Yeah, and I think every institution is kind of figuring out how to sort of innovate and do a better job, but there's still a lot of room to go. I think there was something, another thing that came to mind was, a lot of people are taking time between, their bachelor's degree and medical school to explore other things, take coursework, that sort of thing. But also in medical school, I think that there's a growing number of students who are pursuing things like masters in public health or other degrees or experiences during medical school. And if that's something that you're interested in, that you could ask, like, how many students have taken advantage of that? Is there like funding or things to support you, and if that is something that you're interested in pursuing. I know one of the questions that came up again was the financial piece, kind of how do you support yourself without loans, although I think that's very hard to do. I didn't get away with not taking loans. I think everyone, most people do. I shouldn't say everyone. Some people are really fortunate. One of the things I will just mention for those who might have an interest in it is MD PhD programs. So if you know that you're interested in doing both going into medicine clinically, but also in research, MD PhD programs are typically like you're funded the whole time. So your degrees are paid for, and you also get a stipend, if I'm not mistaken. You are applying into both a doctoral program and your MD program, but that is one thing. There are also, you can, if you're somebody who might have an interest in sort of, service in the military or in other ways, there are ways to get your medical school kind of paid for and then pay it back in a way with service. So I've definitely encountered some people who are doing resident, who have gone that approach. Those are the big things that I can think of. There are ways to get, like I was mentioning, like work study type of jobs, or like work, mentor. You could like do MCAT courses for pre-meds, that sort of thing. Like there are ways that people sort of make money while in medical school. But I think just with the loans piece, I think being very sort of mindful that private loans, like interest rates and private loans, can be a lot trickier and more expensive than loans through your institution or through the government. And so just talking, to financial aid officers or that sort of thing and trying to exhaust all resources is helpful. I don't know if there are any other ideas. I think there was one question about a difference between DO and MD, which admittedly, I think both Rahwa and I I went to an MD program. She is in one now. DOs, it's a different sort of curriculum. Like, I think my understanding is like osteopathic programs have a lot more of an emphasis on like, I don't want to say like not Western medicine. I guess I'm not an expert. We'll try to put something maybe in the blog post about it, but they're kind of very different training programs. That said, whether you're a DO grad or an MD grad, you can apply to residency. My sense is that it can be more challenging to match into certain subspecialties from DO programs. But again, I'm not an expert in that. So maybe we can look more into it and address that in the blog post.
Yeah, unfortunately, sorry, same. I'm not all that familiar with DO schools. I have a couple of friends that are in DO schools, and from my impression of their education, it seems as though it's quite similar to mine. They just have additional training in what Martha was hinting at, kind of more of like a holistic, non-Western medical techniques as well. So yeah, that's kind of my understanding of it, but I'll be sure to include that in the blog.
Great. What other questions have come through? Any tips studying for step 1 or step 2 exam? So I think that's a good segue into the fact that our hope is that if there's an interest in conversations like this one, that we can set up kind of future conversations about kind of preparing for applying for residency or, navigating the residency process, not to mention, or also that there was an interest in helping folks explore other career paths. So being a physician is like one way to be in healthcare, but we've seen in the chat that some people are pursuing, nursing. There are also other roles like nurse practitioners and physician assistants, which I think are growing in popularity and are a different career track. And so if there is an interest in kind of having conversations like this down the line, I'm sure Habesha Health would be very excited. And if there are those in the audience who are in any of those lines of work and want to be involved, we'd encourage that too. Yeah, pharmacy, also a big one. I love our pharmacists. They are super helpful. So would definitely love to host those things in the future. And there was a question about sort of, pursuing nursing school and then going into medical school. And I think that similar to anyone who pursues kind of a different track before going into medicine, it's just very important to be able to name like why medicine, like why being a physician is the sort of way in which you want to engage in that work. We can definitely put our heads together to think about whether we know anyone who's done that before to put you guys in, to put you in touch. But yeah, anyways, there will be this recording will be available on the website on Habesha Health, and like we said, there will be an accompanying blog post. So for questions that we didn't get the chance to answer today, we'll aim to try to address those on the blog post or reach out to you individually to get back to you. But before we go, and Rahwa, any last thoughts or things that you wanted to share?
No, I just want to thank everyone for coming out and for your great questions. And if you have any additional questions, I'm also going to include my email address on the blog post, so feel free to reach out to me.
Yeah, same. I love doing mock interviews and stuff like that. So if you guys ever have an interest or just have questions, always happy to be in touch. But want to be respectful of y'all's Sunday and time. And so I think with that, we do encourage you to give us feedback. The link is in the chat about how you thought the session went, and also if you have ideas or thoughts about future sessions. In addition to doing things that focused on preparing folks in order to embark in a career in healthcare, we do sort of more health specific topics. And so feel free to give us ideas about topics that you would like to see there. Great. And come join us in medicine. We need you guys. I would love to see you.